how to work with difficult patients, and the importance of being a people person and good communicator. What's up guys, my name's Antonio and this is Megan, and we both work in physical therapy, and in this channel we talk about the ins and the outs when it comes to physical therapy. So if you're new to the channel, consider subscribing and hit the bell notification so that you don't miss any of our new upcoming content. And in this video we're going to be talking about the importance of being good at communication. So in school I didn't have, it was very like a basic understanding of communicating, and it was all about, respecting cultural differences. But it never really went into depth of how do you work with a depressed patient, how do you work with an angry patient or an optimistic patient, or maybe a patient who is quiet and doesn't want to share a lot of information, but you're trying to get information to write your subjective. So like, what are some tips, what are some strategies of how to communicate more effectively? Because at the end of the day, if you have the best intervention to give the patient, but you don't know how to communicate that effectively or how to convey that, then you're not going to be very effective at treating that patient. So we're going to jump into some tips on how you can communicate more effectively.
All right, so we're going to start with the takeaway message. What's the take-home message? And that is put the patient first. That sounds really obvious, obviously, and it sounds kind of vague, so we're going to break that apart for you. The first thing that comes to my mind is I tend to be more shy or introverted in general, and when I first started practicing, I used to think I'd have to be one way, like really outgoing or energetic. That's what was in my mind about what it means to be sociable or outgoing. And I found that as I began to work with patients, not everybody needs that at the moment. So I think of somebody who has pain and they're hurting and they don't feel good. That's not necessarily what they want from you anyway. So I realize it's okay, to listen to the patient, to hear what they're struggling with, and to respond in that way. So that might mean being calm and supportive versus being energetic and enthusiastic, which might be more appropriate at a different time.
Yeah, so changing your approach based on how the patient is responding to you. So we base the way we communicate on how the patient is doing, not on how we're feeling, but on what would be best for the patient.
Right. So instead of like thinking of it as I need to be this way, thinking about how we can be adaptable.
Okay, so how would you apply this then to, say, a patient who is experiencing grief? Like what's a strategy? How could you apply to change your approach to someone who's experiencing grief then?
I think the biggest thing is just listening. So that sounds kind of silly, but you actually get to know them and find out what they're struggling with when you just sit and listen. And it also gives them a way to just talk about what they're struggling with, because a lot of times you're not necessarily going to be able to solve their problems, but they just want to tell somebody about it. So listening is huge.
Yes, taking time for them. Now, how would you respond to someone who's in a depressive state? A patient who has just, we see all sorts of different patients, and one might have just came out of a stroke versus someone who had a total knee replacement. But regardless of what the different situation is, oftentimes it impacts their life in a big way. So how would you change your strategy then when someone has a big life problem that now you're the one that they see? Maybe we're the front runners, maybe we're part of the team that needs to comfort them and to be there for them more than just providing an exercise, but actually being there for them as a person.
Yeah, I mean, the same thing goes as listening, but I also think like sometimes when somebody's in a down mood or something like that, they don't really want to talk. And so the one thing I think about is how to start that relationship is ask open-ended questions so that it gives them an opportunity to say something instead of just yes or no or a nod. And the other thing I think about is if they do say something, repeat what they say, like the last few words. So it lets them know that you're listening, and it kind of prompts them to talk about it more, maybe.
Talk about it more, maybe.
Right.
I'm just kidding. No, but yeah, like repeating the last little bit helps them to do it. We actually try out different things like that. I even tried it on my wife, and she talked all the time after that, but it works. So doing things like that, like implementing small strategies into your treatment session will definitely help your communication with patients. And going back to that same situation when you're dealing with a patient who is depressed, don't always just assume that you need to be a calm and quiet demeanor. Don't just say, well, he's depressed or he is experiencing grief, so I should respond this way. No, you should respond based on that patient specifically. So use your clinical judgment to make that decision of how you should respond, and use different cues too that you obtain from the patient to change how you approach that situation.
Right. One of the ways that I find it easy to find out what they want from you is ask them about experiences from other healthcare providers. So sometimes I'll ask them, like, how did your doctor's visit go, and what did you like or what didn't you like? And it's funny because often they'll tell you what they were wanting. Like they'll say, well, he just didn't take time for me, he wasn't listening. So that right away, that's my cue to say, oh, like I should listen. Or they'll say, it went well, but they were just pretty straight-faced. They didn't laugh at my jokes. Like I've had a lot of people tell me that before. They weren't very cheery. And so that's my cue to be more energetic or happy or outgoing. Just knowing what they want from you is super helpful, and asking them the right questions might lead you to know what it is that they're looking for.
So again, it goes back to that point of just listening to the patient and then responding of how they tell you to respond. Basically, we're just helping them along that journey with that. So as we're adjusting our demeanor to meet the patient's need, one thing that we're not trying to say right now is we're not trying to manipulate patients or to be fake. So if I'm really excited, I'm the same person, I'm still Antonio, as when I'm calm and I'm just relating to someone one-on-one. I'm still the same person. I'm not changing my personality, but I do want to at least think about and be mindful of maybe changing my demeanor or my excitement to best meet the needs of the patient, to put them first, not myself, because they're here for therapy. They're paying me, I'm getting paid by the insurance companies to best help them. I'm not here just to be like, well, I'm always fun, and if they don't like it, then deal with it. It's not that at all. We should be considerate of their feelings and how they're responding, but still being true to our own personality as well.
Right, so you'll have days I feel like that you're tired, or maybe you had a bad day at home, but that stuff should be left outside the clinic, and this should be a time where that whole session is about them. And rehab does include connecting with somebody and helping them through that journey, so I think it's important. So if we change the word communicate to connect, I feel like it might help remind you that we're looking to create a relationship with a patient in a way that would help them progress and meet their goals. So if you think about that, that might help remind you to put the patient first.
So if you found this video helpful, then hit a thumbs up on it and let us know in the comment section if maybe you have other tips or strategies of how you communicate effectively with patients or with friends or with family members. Maybe let us know in the comment section some of your guys' stories of what you guys have done, because that's where the best conversation happens, is in the comment section. So let us know on that, and share the video if you liked it, and we'll talk to you later then. So peace.